Your coughing dog has been diagnosed with liver disease. Is there really a connection, and most importantly, what can you do about this?
Are you looking to learn more about natural pet health and wellness? You've come to the right place. Click the link to subscribe to Veterinary Secrets.
Little Tula, the YouTube star, she has intermittent bouts of coughing. When I fairly loosely palpate her windpipe or her trachea, as you'll notice here, she's gonna cough. Oh. Tula has a very common condition affecting many dogs. It's called tracheal collapse. Your dog's airway, aka their trachea, it's made up of these little C-shaped cartilaginous rings. And that gives a firm structure to the trachea. In some dogs, the cartilaginous rings of the trachea, they'll just fold in on themselves. So as you can imagine, that firm rigid windpipe is no longer a firm rigid windpipe. It just collapses in on itself. When you get that trachea collapsing together like this, then your dog starts to cough. It's much more common in the small dogs, the toy breeds, think of the Yorkies, the Poodles, etc. But any dog can potentially get tracheal collapse. One of the primary diagnostic criteria to diagnose this is just by loosely palpating over top of the trachea. And if that little bit of force is just enough to get your dog to cough, then they likely have tracheal collapse. Tracheal collapse most commonly affects middle-aged to senior dogs, so dogs between the ages of 4 and 14. The most common clinical sign, this persistent dry hacking cough. It's a bit of a goose honking cough. Anything that's going to irritate the airway, that can trigger the coughing. The one big differential you usually want to rule out is heart disease. So at very least, you're going to get a basic workup at your veterinarian, which is going to include chest x-rays. It's also important though to get your dog's liver function tested. Now we're seeing this direct correlation with dogs that have tracheal collapse and liver disease. So primarily what's thought is we have these dogs that have untreated tracheal collapse, or it's not being managed adequately. They're not getting enough oxygen. Their liver is getting deprived of oxygen. We're seeing damaged liver cells. We're actually seeing liver disease. In this one study, 92% of the dogs that they tested that had tracheal collapse also had concurrent liver disease. Step number 1, you're focusing on prevention in terms of eliminating or decrease some of those external causes of tracheal collapse. Decrease as many airway pollutants as possible. Get yourself an air purifier. Remove your dog's collar. Replace this with a harness. If your dog is overweight, think of minimizing the treats. There's a clear correlation between obesity and tracheal collapse. Step 2, remedies to treat the coughing flare-ups. First, stay away from traditional cough syrup. The cough suppressant dextromethorphan, there is no evidence that it is effective at all, and in fact, may even be doing harm. This is what I prefer, and it's far more effective. Number 1, honey. Ideally dark, but get whatever honey you can. And number 2, the herb, slippery elm. First, I have a couple tablespoons of warm water. And I'm going to add in about a teaspoon of the honey. We're looking at doses of about a half a teaspoon of the honey per 10 pounds of body weight twice a day. The slippery elm. This is probably the most effective natural anti-cough herbal treatment. I'm adding in one 400 milligram capsule. Tula seems to like this slippery elm honey combination. This is the exact dose for a 20-pound dog, so I'm going to be giving her all of this honey, this water, and this slippery elm. This is a great anti-cough combination, really effective for our dogs that have tracheal collapse. Then number 3, supplements to treat the airway inflammation, decrease mucus production. Number 1, we have 95% curcumin, and number 2, we have quercetin. And one of the big principles in helping our dogs with tracheal collapse, we want to decrease airway inflammation. Then that means they're going to have better airflow, they're not going to be so oxygen deprived, and then we know they're potentially going to avoid having liver disease in the first place. Standard doses of our bioavailable curcumin, 50 milligrams per 10 pounds of body weight daily. Then the second supplement that also has a bunch of studies for airway disease, this is quercetin. Some of the findings are showing that it can decrease airway inflammation. So it's a really good option also for our dogs that have tracheal collapse. We're looking at quercetin doses of our bioavailable quercetin at 50 milligrams per 15 pounds of body weight daily. There is one other conventional treatment I think is important that I mention. It's actually an anabolic steroid called Winstrol. And if you've got a dog that has this really difficult to treat tracheal collapse, and you've tried some of the alternative remedies, you've tried conventional remedies, nothing's working, you can ask your veterinarian about Winstrol. The big thing is what they're finding is so many dogs we're seeing upwards of 50% of dogs in practice, they responded to Winstrol. Then what if your dog was also diagnosed with concurrent liver disease? More than anything, the most important natural supplement for our dogs with liver disease is this. This is milk thistle. Milk thistle, it can decrease liver cell damage and it can help actually speed up liver cell healing. Doses of milk thistle, we're looking at 100 milligrams per 10 pounds of body weight once or twice daily. Tool is about 20 pounds. These are 250 milligram capsules. I'll be giving her 1 capsule a day of the milk thistle. The second really important supplement for our dogs with liver disease is this, SAMe, or S-adenosylmethionine. SAMe especially concentrates in the liver. While it's in the liver, it's converted into a nutrient called glutathione. And that is the most important key nutrient that is responsible for liver repair. Dog dose, 10 milligram per pound. Tool is about 20 pounds. 20 times 10, that would be 200 milligrams. Should be getting one of these 200 milligram capsules once a day. And the last supplement you may want to consider, your dog might already be on it because you're treating tracheal collapse, is this guy. It's the 95% curcumin. What the curcumin is doing, it's like decreasing some of those free radicals, which are damaging the liver cells, decreasing inflammation in the liver, and it's also modulating some of these cell pathways that play a key role in liver cell damage. And it can modulate those in many different ways. So it's another key supplement to really consider adding in if you've got a dog that has secondary liver disease. Thanks so much for watching this edition of Veterinary Secrets of tracheal collapse in our dogs and links with liver disease. Click up there to subscribe, hit the bell to sign up for notifications, and when you click that link directly in the box below, I can send you a copy of my free book.